Hey everybody, thanks for joining us for another episode of Assemble on Us, where we discuss all things tactical. Today we're going to look at our post-disaster survival series, medical considerations, specifically how to build a splint and a sling system to support a fracture of the the forearm. And in a moment we're going to step over to the workbench and take a look at the equipment that we have laid out to perform that task. But before we do, I just wanted to take a moment and give a shout out to my man Hugh Coffey of Ditch Medicine fame. Ditch Medicine, Advanced Field Procedures for Emergencies. If you don't have this book in your survival library, I highly recommend it. It's available through Paladin Press. And Hugh talks about a lot of advanced life-saving and emergency treatment options, things that you're going to need some medical equipment for, and some more in-depth training than what we're able to provide here on Assemble on Us. But Hugh is available as an excellent instructor. We use him many times to provide medical training for Rally Point LLC classes. I've been a student of Hugh's on several occasions and have always really enjoyed the experience. He's good people and he's super knowledgeable in the field of emergency medicine. So if you're interested in learning more about Hugh or scheduling him for some training, you can contact him through us at our website. So let's take a look at the equipment we have laid out for splinting a fracture. Okay, what we have here are the basic materials that we'll need to splint a fracture of the forearm. Store-bought SAM splint, and then one that I improvised out of an air conditioning vent, and we'll show you a little bit more about those in a minute. Flashlight, always good to have several of these around during survival situations. These are rollers from the paint roller, and I'll show you a little bit about how we're going to use those. And then we have some wrapping material. Here's an ace bandage, and then all of this is from one t-shirt that I use these scissors to cut up, and I've put around sticks, and we'll show you how those will unroll here in a little bit. Some tape is always nice to have, and then we've got a scarf that we'll use for the sling when it's all put together. So those are the materials that we need, and you can use different things, sticks, pieces of wood, straight things could be used instead of these. So, you know, these aren't what you have to have, but we'll give you a basic idea of how to use these things and improvise other things to splint fractures. Alright, so let's go over and I'll start putting this all on, and we'll show you how it looks. The first piece of equipment I want to talk about is the SAM splint. They're just a wire or metal lattice work frame, and then it's encased in this foam to make it soft, and so you don't get punctured or it rubs up on you, but you can bend it and it'll stay into shapes. And so you make a little cup here for the elbow, and you can put the elbow in it, and then you have a little lip, a little curl there where the hand could go right into place like that. So that's the SAM splint. If you don't have one of those, one way you can improvise one that doesn't work too bad is to take the air conditioner filter, and you can fold it over to thicken it up and strengthen it, and then it'll do a fairly good job of staying in place as well. And you have this where you can add stability. So that's another way that you might be able to improvise something. So in this case, we're going to imagine that the break is right in here in my forearm in one of these two bones. It's closed, there's nothing sticking out, but I'm really guarding it. It's sort of disformed, it's swelling, pain to move, you know, obviously broken. So we need to immobilize this and keep it from moving around so that we don't cause further damage, and it's also going to help us start the healing process of bringing down swelling some if we can keep this from moving around in our survival situation. So what we're concerned with doing is making sure that we have the joints below and above the fracture site immobilized, so they can't be flopping around, and then the bones in here might be moving around, and then they do snap and come sticking out, which would be bad. So what we'll do is use the SAM splint and sort of put the hand in here like this, and again we use this little curl here. So I've already got this one pre-measured out, and then what I've done, let me put this down for a second. That t-shirt that I talked about, I just cut one long strip out of it, but then left one of the arms kind of there, so I could just put my elbow into it here, and then this now acts as additional padding, aids in compression, and keeps my arm from rubbing, especially if I have an improvised one. And then what I can do is just take this, and this is all based on you're in the survival situation on your own, and you don't have a lot in the way of support or anyone that can help you. So we get it sort of wrapped up in here like this. And then what I want to do is take one of our paint rollers that's already rigid and padded, and I'm going to put that right there. And see. So this isn't going to feel really good. But what I'm doing now is wrapping this snugly enough that it's compressing to keep the bones in place and for moving around, but I'm not wrapping it so tight that I cut off circulation. That's one of the reasons we want to leave the fingers out here to be able to move, so we can check and make sure that we haven't wrapped this thing too tight. So I can continue to do that until I reach the end, and then I can tuck that up underneath there, and then I'm going to use this next one. So now I've got the wrist immobilized. I really can't, I can move my fingers, but not the wrist itself. And then hopefully what I'm going to do, and in this case we decided to leave the shirt on the patient. It's cold outside, let's imagine, and part of what we're trying to do is keep them from going into shock, so we keep their body temperature up. But what we have here is we've used the sleeve of the shirt to kind of hold that in place, and then I can take my ace bandage, and I've got a little notch cut in there so I can grab it, and then we catch that. Alright, so obviously moving around a little bit more than I probably would be if that was really broken. I'd be really guarding that a lot more closely. And then I can take my last one and just give it a few more wraps around here to make sure that this isn't going to go anywhere. And again, I can pull these underneath here. And then, if I want to, I can take tape, and I'm not using a lot here just for demonstration purposes, but I could come back, and I don't want to tape it up too much, but I could put a couple of pieces of tape around the different places to help hold that up in place. And now that is not too bad. It's comfortable, you know, keeping in mind that this is broken, but it's lightweight. I've got padding here now if something, and of course I need to go in here and I would tape these up and pin them, maybe safety pins or some way of securing all that, but so that you can get it off. You want to look at this, or you know, air it out or whatever. And then what we want to do is make sure that we still have capillary refill. So we'll just pinch down on the fingernail bed. It turns white. 1001, 1002. It should be coming back to a nice healthy pink. If it stays white, we've got to come back in here and loosen this up and make sure we're getting blood flow into here. All right, so here I've used my scarf to improvise just a simple sling for my arm. And if I further wanted to protect it, I could come in here with another piece of wrap and come around the chest and pin this arm. Now it would be slung and then pinned up to me, and it really wouldn't be going anywhere. As long as the patient's other hand is not injured, make sure you don't sling it together so his arm is pinned down. He wants to be able to, or she wants to be able to move this arm around, help themselves, do things, adjust, and you don't want to be having them pinned up. They fall over, bash their head, now you have a head injury to deal with. That's always tons of fun. And then the last thing I didn't talk about, this splint system that I made here was nice and soft and padded, but if I had used tree limbs or copper piping or something else to add the rigidity, I want to come in with some padding and put it anywhere where my bone or my hand, arm is going to come in contact with that metal so that it's not rubbing on it and painful. And any place there's a void, you can just come in here and put the padding, and that's going to make that more comfortable. And there we would go. Now our priority would be for evacuation if possible. Can this person walk? Are they able to walk out on their own? Do they require further care? You know, a broken arm like this is painful, but not completely debilitating. You can do a lot of things. It's not life-threatening at this moment. All right, everybody, that's going to do it for today's episode of Assemble on Us. As always, I hope you learned something. Make sure you're going out and practicing. The Red Cross has a lot of really great classes on basic first aid. It's a good start for your first aid knowledge. EMT training is always valuable if you're able to do something like that. And certainly reading and practicing is always key. Kind of take a look around your house. If I had to build a splint, what materials might I be able to use? And just remember, we want to make sure that we've immobilized the joints below and above the fracture site so that that's not moving around. What was a simple break now gets a chance to work itself loose and become an open fracture or cause more pain and suffering to that individual. So we want to make sure it's a nice and stable form. So that's it for us. Until next time, stay safe, be smart, and keep practicing, and we'll see you next time on Assemble on Us. Hey, Curtis, peace.